1 minute. Is it recording?
Yes.
Yes, start it. Just 1 minute then.
After the class, you can see the settings, and then in the next class, I can record the lesson.
Yeah, I will go into the settings. I will go through with this thing. I don't know actually. Okay. So even the next class, what you can, we will see it. Okay. I will try to find out solution for this in next session. Okay. So now I will be doing another thing like sharing the screen again, coming back to the point. It is recording. Yes.
Yes.
Okay. Now the point is we are in the heart cycle. Now, as you said very correctly, the atrium, it has to squeeze, it has to contract and relax simultaneously. So there should be a communication between two, correct? There should be a communication that the heartbeat, like it should not be like once there is ventricular systole, once there is ventricular systole, atrial systole cannot happen. It cannot happen. Both the systoles are happening together. So once the systole is happening, the other side should be relaxed. You understand? This is just like muscles. If we are making the muscles to move, you know, biceps and tricep muscles, you know, yes, in our arms.
Yeah.
In order to make movement, the bicep muscles, they should contract, and the tricep muscles, they should relax. Only then we can fold our arm. And if we want to relax our arm, or we want to stay straight our arms from the folding position, what should be done? The tricep muscle, they should contract, and bicep muscles, they should relax. So only then our arms will be opened up, correct, and they will be straightened. So this is known as antagonistic. The word that in biology we use, this word is really very important. In biology we use a term antagonistic. This is called antagonistic. Okay, bicep and tricep muscle, they are antagonistic to each other. One is relaxing, other is contracting. So in this way movement is happening, correct? So similarly, contraction, systole and diastole is also antagonistic. Once one area of the heart is in systole, it is contracting, other area of the heart, it is relaxing. It must be, it cannot happen that atrium is also contracting and ventricle also it start to contract. It cannot happen. So like you said, both the atria, they should contract simultaneously, correct? Once both the atria are contracting simultaneously, at that time, both the ventricles, they should be in diastole. Agree?
Yes.
So once both the ventricles, they are in the systolic condition, what should be happen with the atrium?
Diastole.
It should be in the diastole, because once the ventricle is emptying itself, it is sending the blood out of the heart. At the same time, blood should enter into the heart through the atrium. Yes, into the atrium. So at that time, atria, they are in diastole, and ventricle, they are in systole. So in this way, heart is removing blood also and receiving blood also simultaneously. So there should be a rhythm. There should be a rhythm. There should be a coordination between atrium and ventricle, that, okay, now I'm contracting, you relax. And once the ventricle will be contracting, you relax. There should be a communication, correct? This is known as, there is one word which is known as CAN or CA node. Sinoatrial node. And there is AVN, atrioventricular node, AVN and SAN. Okay, we call it, instead of node, I will be writing SAN. Okay, SAN and AVN. Okay, what is SAN is standing for what?
I will come in 5 minutes.
Yes, okay.
Yes.
Yes. Back, yes. So,
Yes,
okay, now what we were doing, like there is SAN and AVN, okay? SAN,
mm,
SS stands for Sinoatrial node, okay? And AVN start for atrio, atrioventricular node, AVN, okay? Now, actually, what is the node? Node means these are the electrical points, okay? Signal points where the electrical nerve impulse generates communication between different parts of the heart. Okay, communication between different parts of the heart. I will show it to you through the diagram which is there in our textbook. Okay, just 1 minute. This diagram. Look here. Normally it is here. Okay, this part. So what happened? They communicate with each other. Now I'm in contracting position, so you relax. Okay, electrical signal moves, electrical nerve impulse. That is why once we are talking about ECG, electrocardiogram or electrocardiograph, yes, for any patient who has heart surgeries or heart problems. So we have different kind of, ECG, electrocardiograph we get from the hospitals, correct? So how you get this thing? You get that ECG through the electrical signals which are generated at AV and SAN node. Okay, this is very important, which is generated at AV and SAN node. So there is always a difference in timing when SAN node is there. So SAN node, when the electrical impulse is there, what does it mean? This is both the atrium, they are contracting. So they are in
yeah.
systole. So at that time, the message for both the ventricles, please don't go for systole, the communication. So once the both the atria, they are actually in the systole condition. So at that time, AV and what is the signal that it is still in the systolic position. So please don't move, don't go for the contraction, no, don't go for the systole. Correct. Similarly, once AVN is responsible, so this is AVN and SAN node, they are communication between each other. So now I'm contracting, you relax. Now you are contracting, I will relax. So in this way, so this is the nerve impulse which is moving between SAN and AVN node. Okay, electrical signaling of different parts of the heart. So both the atrium, they will contract simultaneously due to SAN node. Yes, when the electrical signal will be generated, both these muscles of atria, they will contract simultaneously. Okay, both the atria will contract simultaneously. Similarly, once it will reach to the AVN is there where? In ventricle. So once it will reach to the ventricle, then both the ventricle, the signal, the electrical signal, they will vent into the ventricle, so they will contract at that time. So in this way, there is a communication, there is a delay of milliseconds between atrial systole and ventricular systole. There is a delay. So first atrial systole will take place. After that, after few seconds, 0.8 second or 0.5 second, there is a difference. After that difference, the ventricular systole will happen. So this is coordination between different parts of the heart. You understand? Through, and it is managed by SAN and AVN nodes. Got it?
But
It is
these nodes are not mentioned in the book.
Yeah, that is what. I mean, I have just given you for 2 or 3 minutes. You just remember this part because it will happen. I'm not going into the cycle like electrocardiogram is also not mentioned in your book, okay? But I'm just giving you the information that sometimes some unexpected question they may arise. So you should
Hmm.
be in position that how you will be tackling with those conditions, okay? AVN and SAN node, you must know that what exactly they are there to make the rhythm, cardiac rhythm. Okay, cardiac rhythm should be maintained. Contraction, relaxation, or lub and dub. How the lub dub is happening? This is because of SAN and AVN node. Okay, so different parts of the heart they contract and relax by communicating with each other according to their requirement. Okay.
Yes.
Yeah, I'm done. So we are moving to the next.
Okay.
No, CVD, cardiovascular diseases, correct? So now, first of all,
Yes.
there is one atherosclerosis. Sclerosis is actually a condition of hardening of the hardening. When something get hardened, athero is actually from arteries, blood vessels. So what is
Hmm.
atherosclerosis? Atherosclerosis is a condition, it is the hardening of the arteries. Correct? Now, already we know that the walls of arteries, they are elastic, correct?
Yes.
Can the walls of, can arteries, they can manage, they can change the blood pressure of the blood pressure? Arteries,
No.
they can change. Why? Because they have the
How?
elasticity, correct?
Oh, yes.
They have the elasticity. So where it is required that blood pressure should be higher, so they get narrower.
Hmm.
And where they want that in this area the blood pressure should be lower, so they get little bit wider. Adjustment is there with arteries because they have the elastic fibers, correct? So please remember this part. Last time you were absolutely clear about this, but this time you are talking in different thing, okay? So what happens due to this? So once these arteries because of atherosclerosis, arteries, they actually tend to lose their elasticity. We will be discussing how exactly it is happening.
Yes.
Okay. Now, the point is, so atherosclerosis is the hardening of the arteries. This hardening happens because of plaque. What is plaque? Plaque, mostly we talk about plaque on our teeth. Yes. The yellowing of the teeth, the plaque comes and then we have to use the brush and all. Yes, correct. So build up of some, extra material, fatty materials on surface. Okay. So
Yes.
this plaque, this is actually once the cholesterol levels are higher in one person, okay, the chances of atherosclerosis it start to increase. Why? So this plaque is what fatty tissue is there, correct? Tissue is there, correct? Now, whenever the fatty tissue is more, what happens to normal pipes at home that we are using for our washrooms or for our kitchens? Obviously, in kitchen we are using lot of fatty. We are washing them. Yes. So the pipes of the kitchen, if you have ever observed, so they become inside. They have lot of plaque.
Yes.
Correct. Now, this addition of the plaque, it starts from the beginning, from the childhood itself, it start to begin up. Here, the second line, if you see, it is a normal thing. Okay, it is a normal thing. But you know what? Once it get abnormal, once a person is having unhealthy lifestyle, unhealthy food, and this is normal. Plaque will happen with every person, whether it is healthy or unhealthy. Correct. But the how it will be increasing, that depends upon our lifestyle.
Yeah. It
Okay.
is in genes, right?
No, that we will be discussing later. It can be in genes. Okay, it depends upon your gender. There are a number of other factors which we cannot control. Okay.
Yeah. Okay.
It is in genes, correct? Okay, there are other factors also. It is genetic. Like some families, they are more vulnerable to heart attack as compared to others.
Hmm.
Okay. Now, what happened actually? How this plaque develops? First of all, if you look at this picture, once some area get damaged, endothelial is what? Endothelial tissue is the tissue of inner layers. Endothelial, okay, endothelium or endothelial cells, okay. Endo mean ectothelium is thelium means layer. Thelium means layer. Endothelium means inner layer. Ectothelium means outer layer, and mesothelium means central layer. It is easy, yes? I don't have to explain.
Yes.
Correct? Now, this is endothelium. So inside this endothelium, the fat they start to get deposit.
Hmm.
Okay? Why they are getting, so for example, some kind of injury was there. Because of this injury, what will happen? Here, the scab will be formed. Platelets will come, and those platelets, they will be making a scab on top, correct?
Yes.
Now, that platelets one, it will be, so this is actually the build-up of cholesterol. Here, if you see, the artery leaks to an inflammatory response followed by a build-up of cholesterol. Okay, once the arteries layers, they get damaged. Correct?
Hmm.
Okay. Now on top of it, the fatty acids, okay, the a fatty deposit grow to form a atheroma. What is atheroma? Uh,
Um.
a mountain, a kind of pile up. Okay, atheroma.
Okay.
Okay, this atheroma is made up of what? It is made up of fatty deposits.
Yes.
So once
Yes.
what is happening? Inflammation. What is this inflammation? this plaque, okay, fibrous tissue and calcium salts build up around the atheroma, correct? This one on top. So this is, uh, so now actually what is happening, the thing that we have to remember, this plaque keep on adding, keep on increasing. It started with what thing? It started with the injury, internal injury. Due to the internal injury, what happened? The white this platelets, they started to make a scab. On top of that scab, what happened? It started to make fatty deposits. They started to get accumulated. So it actually bulge. It gets swollen, that area. So in with the passage of time, it keep on increasing, increasing, and increasing. Yes. So ultimately, a condition comes, the worst condition, where it actually completely blocks the artery. It keep on increasing, and in this way, the artery is completely blocked. So this is the problem with those people who are suffering from atherosclerosis, blockage, blood vessel blockage.
Yes.
Yeah, okay. Now this is general topic, so we don't have to spend that. Look, we spend a lot of time for this heart kind of thing. Yes.
Yeah.
Yeah. Now, if you look at this exam hint, so here, this sequence you have to remember. This Mariam, you know what? Learn the stages of development of atherosclerosis. Damage to the endothelium artery is correct. Then inflammatory response. What is the
Yes.
inflammatory response? White blood, these platelets, they come and they start to make a scab. Then inflammatory
Yeah.
response. What is inflammatory response? So white blood cells, they're accumulating, correct? Accumulation of
Yes.
cholesterol. It will make atheroma. Atheroma will increase into the fibrous and calcium salts. They will get further deposited. You know, in our teeth. So first it start with the plaque. उसके बाद वो कीड़ा लग जाता है ब्लैक वाला.
Yes.
Correct. So this is the same kind of thing. So जब atheroma बन जाता है, after that what happens? The calcium salts and fibrous tissue it start to accumulate. वो उसको further harden कर देते हैं plaque में. So, this elasticity ka narrowing and the loss of elasticity of the artery, this I will explain it to you. So this is, you have to just remember this sequence. What exactly is happening? So first, there is a damage to the artery surface, correct? Then inflammatory response come. This platelets, they make a scab. After that, cholesterol start to deposit. It turns into the shape of atheroma. Atheroma start to increase in the size. In that atheroma, deposits of what? Fibrous tissue plus calcium salts. So it make it, calcium salt deposition make it harder. You got it? When the calcium salts, they will get deposited into the atheroma, it will get hardened. Like calcium salt, they make our bones and teeth very strong, sir. So same is the case here. So that atheroma will get hardened, and ultimately if it keep on increasing, it will completely block a blood vessel or partially block a blood vessel. Both conditions are dangerous. And once it get hard, so down which the elasticity of the artery, it is actually lost. That I will explain how next. Now you know it already. Yes, this all part we did it. Once damage to the endothelium, blah blah, atheroma is formed, and this atheroma has calcium deposition, it
Yes.
thicker, blah blah. Okay. Now, effect of, this is important, effect of atherosclerosis on health. Now, first is aneurysm. What is aneurysm? You know what? For example, this area is there. Blood flow is in this condition. Look, I will be showing it to you. Blood flow is, for example, is it is in this condition. Yes, in this way, blood is flowing. Now, blood is coming in this way. Once blood will reach here, what will happen? The speed of the blood will be narrow, slower.
Yeah.
When the speed of the blood will narrow, chances of further increase, settlement of the cholesterol increases. Remember, when the blood flow, कोई भी liquid है ना, which has salts inside, if the flow of the water is slow, deposition will be faster. If the flow of the water is fast, okay, the deposition, settling of the salts will be less. So same is the case here. Look, once the blood will have a kind of barrier inside here. Yes. So once the blood is flowing with the speed, once it will reach here, it will slow down. Due to the slowdown, what will happen? More deposition of cholesterol here or salts here. Correct? So now because of the blockage in this area, back of this atheroma, beside the back of this atheroma, there will be more pressure on these walls of the artery. Yes.
Yes.
So once they are under more pressure, so they are in continuous stress. इस stress में उनको नहीं
Yeah.
होना चाहिए, but they will be in the continuous stress, correct? Because of this continuous pressure, which is more than the normal, so they will lose their elasticity. So, for example, if you have a rubber band, okay, if the rubber band you are stretching that rubber band for 5 times, no problem. But same rubber band, if you are stretching it for 5 times in a day, what will happen? It elasticity will not be damaged. But if the same rubber band you keep on stretching it for 500 times, what will happen? This rubber band will lose its elasticity. So same is the case with this arteries before this one, before this atheroma. This part of the artery, the elasticity will be lost. Once the elasticity will be lost, and moreover, this is deposition of what? Deposition of salt. So it will get harder. Actually, this part should not be hardened. This was elastic, correct?
Yes.
This was elastic part in before this atheroma. It was elastic part. It can easily move. But now this part of the artery, it will get hardened. Once
But
it will get
because of
hardened,
the
there is a chance
pressure,
of I'm sorry.
because of the pressure, it will lose its elasticity, right?
Yes, behind behind the atheroma.
Yeah.
Okay, and moreover this wall is become hardened. Once it will become hardened, this area is what? This area is having more pressure. Because of this pressure and this wall is hardened, this wall may burst. It will burst because of the pressure.
Then what will happen?
So once the this is known as
Heart attack.
internal bleeding. No, internal heart attack. They are something different. I will tell you that thing. This will lead to the internal bleeding. Okay, this will
Okay.
lead to the internal bleeding. This condition will lead to the internal. So what is aneurysm? Aneurysm is an increase in pressure before the atheroma, which weakens the walls of the arteries. So जहाँ पे walls of the arteries, अब ये क्या होगा? Walls of the यहाँ पे क्योंकि अब ये यहाँ पे walls of the artery, यहाँ पे जब pressure आ जाएगा तो क्या होगा? ये पिछला हिस्सा जो है ना, it will bulge, ये swell कर जाएगा. क्योंकि इसमें ब्लड ज्यादा हो गया है, सो ये वाला एरिया जो है ना, इट विल बल्ज, इट विल गेट स्वोलन. व्हाई? बिकॉज आगे निकलने का बहुत कम स्पेस है या टोटल स्पेस है ही नहीं. करेक्ट? So once it will keep on bulge, it will remain in this bulging condition. What is the result? The walls of the artery, they get weak. They will lose their elasticity, and sometime due to this pressure, it may burst, internal bleeding, which can be fatal.
Yes.
Okay, so now this aneurysm mostly happen with those people who are at the more risk of atherosclerosis. So internal bleeding is the major problem for them. Aneurysm. This is effect of atherosclerosis or on health. So first effect, what is the first effect? It will be causing aneurysm. Now understood aneurysm, correct? Second, it will be raising the blood pressure. Obviously, the blood pressure will be raised. Why? The blood vessel is narrowed. Once the blood pressure will increase, what will be the effect on the elasticity of the arteries? Again, arteries, they will get weakened. They will lose their elasticity because arteries will be under more pressure. So more than the normal pressure if it is there. So atherosclerosis, first it will cause aneurysm. Aneurysm can cause what? internal bleeding. Correct? Secondly,
Yes.
atherosclerosis can raise the blood pressure. Obvious, this is obvious. Because of the atherosclerosis,
Yeah.
the blood pressure will increase. So blood pressure has multiple effects on the health. It will weaken the arteries, more pressure on the heart. Heart has to pump with more force because the arteries are narrow now. So it has to pump with more force. So heart is also getting weaker and the arteries elasticity is also getting weaker and weaker.
Yeah.
You understand? So here now they are talking about high blood pressure. It can lead to the kidney damage, kidney failure also, or high blood pressure can lead to the eyesight damage, blindness. There are different kind of problem. Or with the high blood pressure, person will be getting psychological impact. They will get violent or they will get hyper very quickly. बहुत जल्दी गुस्सा आ जाता है. Correct? So all of this is
Mm.
actually linked with atherosclerosis. Correct?
Yes.
नेक्स्ट इज हार्ट डिजीजेस. हार्ट प्रॉब्लम. हार्ट प्रॉब्लम में ना दो चीजें हैं. एक होता है एंजाइना और दूसरे को कहते हैं हार्ट अटैक और मायोकार्डियल इन्फार्क्शन. ये आपने याद रखना है. ये वर्ड है हार्ट अटैक को इन बायोलॉजी वी कॉल इट द पर्सन वेंट इनटू मायोकार्डियल इन्फार्क्शन.
Okay.
ठीक है. नाउ व्हाट इज एंजाइना? Angina is a condition. I will be showing you this thing. Look, now these are two heart attack conditions.
Angina is a small heart attack.
Yes. Angina is actually, sometimes we call it, angina is a sign of the heart attack. You know, some people they say, I have a pain on my left side of heart and this pain is extending into my left arm, the full arm.
Yeah.
Have you experienced this thing by yourself or no? God forbid.
No.
No, Alhamdulillah. You know what? Sometimes the people they complain like I have pain on my left hand, in my left arm, and then I have pain in my this left part of my body. So they suspect that this is a kind of heart attack, beginning of the heart attack. This is a symptom. So now look here. This is a small artery, yes, small artery which is providing blood to a small part of the heart.
Yes.
So this will affect only a small part. So that is we are calling it a small heart attack. But if the main blood vessel is blocked, this blood vessel will be blocked because of what? Atheroma, atherosclerosis. If the atheroma is bigger, yes, and it is big enough, so it will be blocking. If it blocks the big artery, which is a coronary artery, the arteries which supply blood to the heart, they are known as coronary arteries. Yes, you know this. Yes.
Yes.
Okay. So if
Yes.
the major coronary artery is blocked and it is supplying to a large a part of the heart, so it will be causing a big heart, a major heart attack. And if it is smaller, it will be having a smaller heart attack. Then you know this stent which is there. What is the purpose of the
Yes.
stent? What is a stent
They
actually?
remove a vein from the leg and put that vein into the
नहीं
heart.
नहीं, वो तो उसको
Bypass
कहते
surgery.
हैं bypass surgery. Stent दूसरी
हाँ.
चीज है.
bypass.
Stent क्या होता है? Stent is actually a metal tube. For example, if this blood vessel is blocked, yes, what they will do, they will put a metal tube, a tube inside this one. So actually it will move through, it will connect from here. For example, here is the blockage is here, yes, this part. I will draw and then I will explain it to you. Just 1 minute because this is very, very important. Uh, just a minute. So if this is the blood vessel, yes, and here is the atheroma. This part is blocked, correct? This atheroma. Then what is the stent? Stent will be done like I will. You see it now. Here, the stent. It is a tube, a small tube. Why it is happening like this? Just 1 minute.
The yellow one is atheroma.
Yes, yellow one is atheroma. Okay, so it will be like this is now this is a stent now, a small tube, okay, metal tube.
Yeah.
They insert that metal tube into this one. So वो ऐसे डाल देते हैं डॉक्टर्स, करेक्ट. सो उसमें क्या होता है, ये वाला जो ये
atheroma तो
इस
फिर भी
वाले
रहता है ना.
नहीं नहीं वो इस तरीके से करते हैं कि ये जो इसका जो एंड है ना वो स्क्वीज हो जाता है, इसके अंदर से गुजार देते हैं वो. मैं क्योंकि अब आई कैन नॉट शो यू इन डायग्राम. एक्चुअली हुआ ये है कि इसके अंदर से गुजर गया वो, ठीक है. तो वो जो छोटा सा पार्ट है ना, इसको उन्होंने वो क्या किया, उसमें सुराख कर दिया है उन्होंने. दे मेड अ होल पेनिट्रेशन. सो स्टेंट की वजह से क्या
Okay.
होता है, दिस इज अ गुड काइंड ऑफ टेक्नोलॉजी. सो इसमें क्या होता है, एक छोटी सी जगह पे स्टेंट डाल देते हैं. सो जो ब्लॉकेज होती है ना, इट इज रिमूव्ड. और ये जो स्टेंट होता है, इट कैन इंक्रीज एंड डिक्रीज इन साइज. ये क्योंकि ये मेटल है ना, इसका ये इट कैन इंक्रीज एंड डिक्रीज इन डायमीटर अकॉर्डिंग टू द टेम्परेचर ऑफ द बॉडी. ये एडजस्टेबल है.
Yes.
ओके, ये स्टेंट है. और जो आप कह रहे थे ना, दैट इज एक्चुअली उसमें क्या होता है,
Bypass it.
ब्लॉक, वो उसको कहते हैं बाईपास सर्जरी. वो बाईपास में क्या करते हैं, वो एक ब्लड वेसल ले लेते हैं हमारी बॉडी का ही, ठीक है. हमारी बॉडी से एक ब्लड वेसल ले ली और ऐसे करके एक ब्लड वेसल इसको ऐसे ज्वाइन कर दिया. तो ये इसको कहते हैं बाईपास कर दिया उन्होंने एथेरोमा को. यहाँ से एंटर किया और यहाँ से ब्लड फिर दोबारा डाल दिया इसके अंदर. सो ये इट इज परमानेंट देयर. सो यू हैव दिस इज कॉल्ड बाईपास सर्जरी. Nowadays
So
bypass
there will be
surgery,
side effects, right?
it has side effect, definitely it has the side effects, because quality of life, it impaired the quality of life. जिस बंदे की हार्ट यू नो ये कार्डियक सर्जरी हो जाती है ना, उसके लिए मुश्किल होता है to go for even exercises or for walks also. You know what happened, this is my personal thing now. In Pakistan, this time I was there, yes, in
You
Pakistan
have
when I was stuck there.
experienced?
I'm sorry,
You have experienced?
excuse me, not me, I'm talking about my father now.
Oh, okay.
You should pray for like health of everybody, yes. Alhamdulillah,
Yes.
I'm not in that condition by now, you know, Allah knows better.
But
But the point is, I'm saying my father was having problem. He has already gone for the stents. Okay, couple of stents are already there with him, correct. Mashallah, he was having a good healthy life from the last 7-8 years, correct. This time one we went to a doctor and they suggested, oh no, this is very critical condition, we have to go for the bypass surgery. And they told us, give us this much amount, very handful amount they were asking, okay. And big hospital of Lahore, doctor hospital, one of the finest hospitals, okay. So they told there is no solution, but we have to go for the bypass surgery. Then we thought, like, if the bypass surgery, my father age is already very high, yes. So chances, quality of life will decrease, and moreover, in that age, recovery chances are very, very low.
yes.
So we took the opinion of another doctor, and he told there is no need of any kind of bypass surgery. We can manage only and only with medicine. So these kind of doctors, please, once you become a doctor in future, please avoid these kind of things, inshallah. Guide your patients with a perfect kind of advice. There are the patient, there are the doctor who have big dari and they are talking like
Yeah.
nonsense, okay. So this is now, you know what is the difference between stent and the bypass, correct.
Bypass.
Okay.
Yes.
Now you know the what is angina is a mild heart attack. What happens in the angina? It's normally a person comes to know about angina when the person is doing exercise. This is very interesting. Okay. I will be moving to the previous this thing. Look, this is once the heart, once this artery will get blocked, what will happen? This area of the cells, they will not get oxygen. Once they will not get oxygen, they will go for anaerobic respiration, correct.
Yes.
Mariam, this is very interesting. Okay, only this is the concept here. What happened if this artery was blocked? So these areas, because they are not receiving the blood, so they will not get oxygen. Once they will not get oxygen, this part of the heart will do anaerobic respiration. Due to anaerobic respiration, what is the product of anaerobic respiration in human? Which chemical? Mariam, this you have to tell now. Which chemical due to the anaerobic respiration? वो chemical क्या नाम? That will be lactic acid.
Yes.
Okay, lactic acid. Lactic acid का role क्या होता है for the muscles? When the lactic acid is more, it lead to the muscle fatigue, cramps. जो what is muscle fatigue or cramps? Muscle they get stiff and they are unable to move under the lactic acid. Okay. So जब इन cells के अंदर lactic acid की deposition हो जाएगी, why? Because they have to go for anaerobic respiration. So these muscles they will stop contracting. They cannot contract. जब muscle ही contract नहीं करेंगे तो this is known as heart attack. This is mild heart attack. A small part of the heart is getting affected, and this is happening because of lactic acid deposition. Lactic acid deposited because of what? Because of anaerobic respiration. Anaerobic respiration happened because of blockage, because oxygen is not reaching into this area. But if the blockage is in the large blood vessel, so large area of the heart, it will get anaerobically respiring, and large area will be producing lactic acid. If this area will not contract, what will happen? It is fatal. So normally this condition happen due to angina. Angina is, huh?
Can we continue in the next class?
Yeah, just give me 5 minutes. Just last 5 minutes, because I want to finish this off. Okay. So we start with a new topic. Just can you hold for 5 minutes or no?
No.
You are completely exhausted?
Yes.
Okay, then yalla, we stop it here. Just remember this anaerobic respiration and lactic acid deposition. Okay.
Okay.
Okay. Thank you very much. Assalamu alaikum.
Waalaikumsalam.